NCLEX RN Practice Test, Set 1, 30 questions, let's begin. Question number 1. A client is scheduled for a subtotal gastrectomy, Billroth II procedure. The nurse explains that the procedure will have which surgical results: A. Proximal end of the distal stomach is anastomosed to the duodenum, B. Entire stomach is removed and the esophagus is anastomosed to the duodenum, C. Lower portion of the stomach is removed and the remainder is anastomosed to the jejunum, D. Antrum of the stomach is removed and the remaining portion is anastomosed to the duodenum. Answer: letter C. Lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. In the Billroth II procedure, the lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. The duodenal stump is preserved to permit bile flow to the jejunum. Priority nursing tip: postoperative complications after gastrectomy procedures include hemorrhage, dumping syndrome, diarrhea, hypoglycemia, and vitamin B12 deficiency. Question number 2. After undergoing a thyroidectomy, a client is monitored for signs of damage to the parathyroid glands postoperatively. The nurse would determine which finding suggests damage to the parathyroid glands: A. Fever, B. Neck pain, C. Hoarseness, D. Tingling around the mouth. Answer: letter D. Tingling around the mouth. The parathyroid glands can be damaged or their blood supply impaired during thyroid surgery. Hypocalcemia and tetany result when parathyroid hormone, PTH, levels decrease. The nurse monitors for complaints of tingling around the mouth or of the toes or fingers and muscular twitching because these are signs of calcium deficiency. Additional, later signs of hypocalcemia are positive Chvostek's and Trousseau's signs. Fever may be expected in the immediate postoperative period but is not an indication of damage to the parathyroid glands. However, if a fever persists, the primary healthcare provider is notified. Neck pain and hoarseness are expected findings postoperatively. Priority nursing tip: after thyroidectomy, maintain the client in a semi-Fowler's position to reduce swelling at the operative site. Question number 3. The nurse is performing an admission assessment on a client admitted with a diagnosis of Raynaud's disease. The nurse assesses for the associated symptoms by performing which actions: A. Checking for a rash on the digits, B. Observing for softening of the nails or nail beds, C. Palpating for a rapid or irregular peripheral pulse, D. Palpating for diminished or absent peripheral pulses. Answer: letter D. Palpating for diminished or absent peripheral pulses. Raynaud's disease is vasospasm of the arterioles and arteries of the upper and lower extremities. It produces closure of the small arteries in the distal extremities in response to cold, vibration, or external stimuli. Palpation for diminished or absent peripheral pulses checks for interruption of circulation. Skin changes include hair loss, thinning or tightening of the skin, and delayed healing of cuts or injuries. A rash on the digits is not a characteristic of this disorder. The nails grow slowly, become brittle or deformed, and heal poorly around the nail beds when infected. Although palpation of peripheral pulses is correct, a rapid or irregular pulse would not. Priority nursing tip: teach the client with Raynaud's disease to avoid smoking, wear warm clothing, socks, and gloves in cold weather, and avoid injuries to the fingers and hands. Question number 4. The nurse teaches a postpartum client about post-delivery lochia. The nurse determines that the education has been effective when the client says that on the second day postpartum, the lochia should be which color: A. red, B. a pink, C. white, D. yellow. Answer: letter A, red. The uterus rids itself of the debris that remains after birth through a discharge called lochia, which is classified according to its appearance and contents. Lochia rubra is dark red in color. It occurs from delivery to 3 days postpartum and contains epithelial cells, erythrocytes, leukocytes, shreds of decidua, and occasionally fetal meconium, lanugo, and vernix caseosa. Lochia serosa is a brownish-pink discharge that occurs from days 4 to 10. Lochia alba is a white discharge that occurs from days 10 to 14. Lochia should not be yellow or contain large clots. If it does, the cause should be investigated without delay. Priority nursing tip: the amount of lochial discharge may increase with ambulation. Question number 5. The nurse creates a care plan for a client receiving hemodialysis through an arteriovenous AV fistula in the right arm. The nurse includes which interventions in the plan to protect the AV fistula from injury? Select all that apply. A. Assess pulses and circulation proximal to the fistula. B. Palpate for thrills and auscultate for a bruit every 4 hours. C. Check for bleeding and infection at hemodialysis needle insertion sites. D. Avoid taking blood pressure or performing venipunctures in the extremity. E. Instruct the client not to carry heavy objects or anything that compresses the extremity. F. Instruct the client not to sleep in a position that places her or his body weight on top of the extremity. Answer: letter B, C, D, E, F. An AV fistula is an internal anastomosis of an artery to a vein and is used as an access for hemodialysis. The nurse should implement the following to protect the fistula: palpate for thrills and auscultate for a bruit every 4 hours, check for bleeding and infection at hemodialysis needle insertion sites, avoid taking blood pressure or performing venipunctures in the extremity, instruct the client not to carry heavy objects or anything that compresses the extremity. Instruct the client not to sleep in a position that places her or his body weight on top of the extremity. Assess pulses and circulation distal to the fistula. Priority nursing tip: arterial steal syndrome can develop in a client with an arteriovenous fistula. In this condition, too much blood is diverted to the vein and arterial perfusion to the hand is compromised. Question number 6. A client has received atropine sulfate preoperatively. The nurse monitors the client for which effect of the medication in the immediate postoperative period. A. Diarrhea. B. Bradycardia. C. Urinary retention. D. Excessive salivation. Answer: letter C, urinary retention. Atropine sulfate is an anticholinergic medication that causes tachycardia, blurred vision, drowsiness, dry mouth, constipation, urinary retention. The nurse should monitor the client for any of these effects in the immediate postoperative period. None of the other options relate to this medication. Atropine sulfate is the antidote for cholinergic medication overdose, physostigmine salicylate. Priority nursing tip: anticholinergic medications are contraindicated in the client with glaucoma. Question number 7. The nurse provides information to a client diagnosed with insulin-dependent diabetes mellitus. Which manifestations resulting from a blood glucose level less than 70 mg per deciliter, 4 millimoles per liter, should the nurse include in the information? Select all that apply. A. Hunger. B. Sweating. C. Weakness. D. Nervousness. E. Cool clammy skin. F. Increased urinary output. Answer: letter A, B, C, D, E. Hypoglycemia is characterized by a blood glucose level less than 70 mg per deciliter, 4 millimoles per liter. Clinical manifestations of hypoglycemia include hunger, sweating, weakness, nervousness, cool clammy skin, blurred vision or double vision, tachycardia, and palpitations. Increased urinary output is a manifestation of hyperglycemia.
Priority nursing tip: if the client exhibits signs of a hypoglycemic reaction, perform a fingerstick and check the client's glucose level. If hypoglycemia is confirmed, give the client a 10 to 15 g carbohydrate item such as a half cup of fruit juice to drink.
In hyperglycemia, always remember the 3 P's.
Polyuria, increased urinary output; polydipsia, excessive thirst; polyphagia, excessive hunger.
Question number 8. The ambulatory care nurse is assessing a client with chronic sinusitis. The nurse determines that which manifestations reported by the client are related to this problem. Select all that apply. A. Anosmia, B. Chronic cough, C. Blurry vision, D. Nasal stuffiness, E. Purulent nasal discharge, F. Headache that worsens in the evening. Answer: letter A, B, D, E. Chronic sinusitis is characterized by anosmia, loss of smell, a chronic cough resulting from nasal discharge, nasal stuffiness, persistent purulent nasal discharge, and headache that is worse upon arising after sleep. Blurred vision is not associated directly to this condition. Priority nursing tip: inhaling steam may be a helpful measure to treat sinusitis, but the nurse must teach the client the safe method to do so because of the risk associated with burns from the steam. Question number 9. A client is diagnosed with hypothyroidism. The nurse performs an assessment on the client, expecting to note which findings? Select all that apply. A. Weight loss, B. Bradycardia, C. Hypotension, D. Dry, scaly skin, E. Heat intolerance, F. Decreased body temperature. Answer: letter B, C, D, F. In hypothyroidism, the clinical manifestations are fatigue, weight gain, cold intolerance, bradycardia, brittle nails, irregular and heavy periods, puffy face, dry, scaly skin, decreased body temperature, hypotension, depression and irritability. The severe form of hypothyroidism is myxedema coma. In hyperthyroidism, the clinical manifestations are fatigue, weight loss, heat intolerance, tachycardia, nail thickening and flaking, short and light periods, bulging eyes, short and light periods, nervousness and anxiety, diarrhea, increased sweating, muscle weakness. The severe form of hyperthyroidism is thyroid storm. Always remember that fatigue is always common on hypothyroidism and hyperthyroidism. Question number 10. A client is diagnosed with diabetes insipidus. The nurse should plan interventions to address which manifestations of this disorder? Select all that apply. A. Bradycardia, B. Hypertension, C. Poor skin turgor, D. Increased urinary output, E. Dry mucous membranes, F. Decreased pulse pressure. Answer: letter C, D, E, F. Diabetes insipidus is a water metabolism problem caused by an antidiuretic hormone, ADH, deficiency, either a decrease in ADH synthesis or an inability of the kidneys to respond to ADH. The clinical manifestation are poor skin turgor, increased urinary output, dry mucous membranes, decreased pulse pressure, tachycardia, hypotension, weak peripheral pulses, increased thirst. Priority nursing tip: monitor for an electrolyte imbalance and signs of dehydration in the client with diabetes insipidus. If the condition is untreated, the client experiences a urine output of 4 to 24 liters a day. Question number 11. A client diagnosed with pneumonia reports a decreased sense of taste that has greatly affected the motivation to eat and drink. Which intervention should the nurse implement to help increase the client's appetite? A. Offer in-between meal snacks. B. Provide 3 large meals daily, C.
Provide mouth care before meals, D. Offer to sit with the client during meals. Answer, letter C, provide mouth care before meals. The client with pneumonia may experience decreased taste sensation as a result of sputum expectoration.
To minimize this adverse effect, the nurse should provide oral hygiene before meals.
The client should also have small, frequent meals because of dyspnea.
The remaining options will not address the issue of impaired sense of taste. Question number 12. The nurse notes that a large number of clients reporting the presence of flu-like symptoms are being seen in the clinic. Which recommendations should the nurse provide to these clients to minimize their risk for further illness? Select all that apply. A. Get plenty of rest. B. Increase intake of liquids. C. Get a flu shot immediately. D. Take antipyretics for fever. E. Consume a well-balanced diet. Answer, letter A, B, D, E. Treatment for the flu includes getting rest, drinking fluids, and taking in nutritious foods and beverages. Medications such as antipyretics and analgesics may also be used for symptom management. Immunizations against influenza are a prophylactic measure and are not used to treat flu symptoms. Priority nursing tip: because the strain of influenza virus is different every year, annual vaccination is recommended. Question number 13. The nurse instructing a client with chronic pancreatitis about measures to prevent its exacerbation should provide which information? Select all that apply. A. Eat bland foods. B. Avoid alcohol ingestion. C. Avoid cigarette smoking. D. Avoid caffeinated beverages. E. Eat small meals and snacks high in calories. F. Eat high-fat, low-protein, high-carbohydrate meals. Answer, letter A, B, C, D, E. Chronic pancreatitis is a progressive, destructive disease of the pancreas, characterized by remissions and exacerbations, recurrence. Measures to prevent an exacerbation include eating bland, low-fat, high-protein, moderate-carbohydrate meals, avoiding alcohol ingestion, nicotine, and caffeinated beverages, eating small meals and snacks high in calories, and avoiding gastric stimulants such as spices. Priority nursing tip: the pain that is associated with acute pancreatitis is aggravated if the client lies in a recumbent position. Question number 14. A client is diagnosed with cholecystitis. The nurse reviews the client's medical record, expecting to note documentation of which manifestations of this disorder? Select all that apply. A. Dyspepsia, B. Dark stools, C. Light-colored and clear urine, D. Feelings of abdominal fullness, E. Rebound tenderness in the abdomen, F. Upper abdominal pain that radiates to the right shoulder. Answer, letter A, D, E, F. Cholecystitis is an inflammation of the gallbladder. Clinical manifestations are dyspepsia, clay-colored stools, dark urine, steatorrhea, eructation, the release of air or gas from the stomach or esophagus through the mouth, flatulence, fever, feeling of abdominal fullness, rebound tenderness, Bloomberg sign, upper abdominal pain or discomfort that can radiate to the right shoulder, pain triggered by a high-fat meal, anorexia, nausea, and vomiting, jaundice. Priority nursing tip: instruct the client with cholecystitis to consume a diet that is low in fat. Question number 15. A client is experiencing pulmonary edema as an exacerbation of chronic left-sided heart failure. The nurse should assess the client for what manifestation? A. Weight loss. B. bilateral crackles, C. Distended neck veins, D. Peripheral pitting edema. Answer, letter B, bilateral crackles.
In left-sided heart failure, clinical manifestations are pulmonary congestions such as cough, crackles, pink-tinged sputum, and tachypnea. Next is tachycardia, fatigue, cyanosis, external dyspnea. In right-sided heart failure, clinical manifestations are peripheral edema, ascites, enlarged liver spleen, jugular vein distension, weight gain, increased peripheral venous pressure. Priority nursing tip: if the client develops pulmonary edema, immediately place the client in a high Fowler's position and contact the primary healthcare provider.
Do not leave the client. Question number 16.
A client begins to experience a tonic-clonic seizure.
Which actions should the nurse take to assure client safety? Select all that apply. A. Restrict the client's movements. B. Turn the supine client to the side. C. Open the unconscious client's airway. D. Gently guide the standing client to the floor. E. Place a padded tongue blade into the client's mouth. F. Loosen any restrictive clothing that the client is wearing. Answer, letter B, C, D, F.
Precautions are taken to prevent a client from sustaining injury during a seizure.
The nurse would maintain the client's airway and turn the client to the side. The nurse would also protect the client from injury, guide the client's movements, and loosen any restrictive clothing.
Restraints are never used because they could injure the client during the seizure. A padded tongue blade or any other object is never placed into the client's mouth after a seizure begins because the jaw may clench down. Priority nursing tip: if a client experiences a seizure while standing or sitting, gently ease the client to the floor and protect the client's head and body.
Question number 17. The nurse is monitoring a client diagnosed with a ruptured appendix 4, signs of peritonitis. The nurse should assess for which manifestations of this complication. Select all that apply. A. Bradycardia, B. Distended abdomen, C. Subnormal temperature, D. Rigid, board-like abdomen, E. Diminished bowel sounds, F. Inability to pass flatus or feces. Answer, letter B, D, E, F. Peritonitis is an acute inflammation of the visceral and parietal peritoneum, the endothelial lining of the abdominal cavity.
Clinical manifestation are distended abdomen, rigid, board-like abdomen, diminished bowel sounds, inability to pass flatus or feces, abdominal pain, localized, poorly localized, or referred to the shoulder or thorax, anorexia, nausea, and vomiting, rebound tenderness in the abdomen, high fever, tachycardia, dehydration from the high fever, decreased urinary output, hiccups, possible compromise in respiratory status. Priority nursing tip: avoid the application of heat to the abdomen of a client with appendicitis because heat can cause rupture of the appendix leading to peritonitis. Question number 18. While preparing to administer an intravenous IV medication, the nurse notes that the medication is incompatible with the IV solution. Which intervention should the nurse implement to assure the client's safety? A. Ask the provider to prescribe a compatible 4 solution. B. Start a new 4 catheter for the incompatible medication. C. Collaborate with the provider for a new administration route. D. Flush tubing before and after administering the medication with normal saline. Answer, letter D. Flush tubing before and after administering the medication with normal saline. When giving a medication intravenously, if the medication is incompatible with the IV solution, the tubing is flushed before and after the medication with infusions of normal saline to prevent inline precipitation of the incompatible agents.
Starting a new IV, changing the solution, or changing the administration route is unnecessary because a simpler, less risky, viable option exists.
Priority nursing tip: normal saline is physiologically similar to body fluid and is generally the solution of choice to flush an intravenous line.
Question number 19. The nurse is preparing to administer eardrops to an infant.
The nurse should plan to proceed by taking which step to assure the appropriate installation of the medication. A. Pull down and back on the auricle and direct the solution onto the eardrum. B. Pull up and back on the earlobe and direct the solution toward the wall of the ear canal. C. Pull up and back on the auricle and direct the solution toward the wall of the ear canal. D. Pull down and back on the auricle and direct the solution toward the wall of the ear canal. Answer: letter D. Pull down and back on the auricle and direct the solution toward the wall of the ear canal. The infant should be turned on the side with the affected ear uppermost.
With the non-dominant hand, the nurse pulls down and back on the auricle. The wrist of the dominant hand is rested on the infant's head. The medication is administered by aiming it at the wall of the ear canal rather than directly onto the eardrum. The infant should be held or positioned with the affected ear uppermost for 10 to 15 minutes to retain the solution. In the adult, the auricle is pulled up and back to straighten the auditory canal. Priority nursing tip: for an infant or child younger than 3 years, pull the auricle down and back to administer ear medications. For a child older than 3 years, pull the auricle up and back. Question number 20. A client seeks treatment in an ambulatory clinic for hoarseness that has persisted for 8 weeks. Based on the symptom, the nurse interprets that the client is at risk for which disorder? A. Thyroid cancer. B. Acute laryngitis. C. Laryngeal cancer. D. Bronchogenic cancer. Answer: letter C. Laryngeal cancer. Hoarseness is a common early sign of laryngeal cancer, but not of thyroid or bronchogenic cancer. Hoarseness that persists for 8 weeks is not associated with an acute problem, such as laryngitis. Priority nursing tip: risk factors for laryngeal cancer include smoking, heavy alcohol use, exposure to environmental pollutants such as asbestos or wood dust, and exposure to radiation. Question number 21.
A client is admitted to the cardiac intensive care unit after coronary artery bypass graft (CAB) surgery. The nurse notes that in the first hour after admission, the mediastinal chest tube drainage was 75 milliliters. During the second hour, the drainage has dropped to 5 milliliters. The nurse interprets this data and implements which intervention? A.
Identifies that the tube is draining normally. B.
Assesses the tube to locate a possible occlusion. C.
Auscultates the lungs for appropriate bilateral expansion. D. Assists the client with frequent coughing and deep breathing.
Answer: letter B. Assesses the tube to locate a possible occlusion. After CAB surgery, chest tube drainage should not exceed 100 to 150 milliliters per hour during the first 2 hours postoperatively, and approximately 500 milliliters of drainage is expected in the first 24 hours after CAB surgery. The sudden drop in drainage between the first and second hour indicates that the tube is possibly occluded and requires further assessment by the nurse. Options A, C, and D are incorrect interventions. Priority nursing tip: after CAB surgery, monitor the client for hypotension and hypertension.
Hypotension can cause collapse of a vein graft.
Hypertension causes increased pressure and can promote leakage from the suture line and bleeding.
Question number 22.
The nurse is assessing a client diagnosed with pleurisy 48 hours ago. When auscultating the chest, the nurse is unable to detect the pleural friction rub, which was auscultated on admission. This change in the client's condition confirms which event has occurred. A. The prescribed medication therapy has been effective. B.
The client has been taking deep breaths as instructed. C.
The effects of the inflammatory reaction at the site decreased. D.
There is now an accumulation of pleural fluid in the inflamed area.
Answer: letter D. There is now an accumulation of pleural fluid in the inflamed area.
Pleurisy is the inflammation of the visceral and parietal membranes.
These membranes rub together during respiration and cause pain. Pleural friction rub is auscultated early in the course of pleurisy, before pleural fluid accumulates. Once fluid accumulates in the inflamed area, there is less friction between the visceral and parietal lung surfaces, and the pleural friction rub disappears.
Options A, B, and C are incorrect interpretations.
Priority nursing tip: instruct the client with pleurisy to lie on the affected side to splint the chest. This will ease the pain when coughing and deep breathing.
Question number 23. The nurse provides information to a client with a colostomy. When discussing measures to help manage colostomy odors, the nurse will encourage the client to regularly consume which foods? Select all that apply. A. Parsley B. Yogurt C. Buttermilk D. Cucumbers E. Cauliflower F. Cranberry juice. Answer: letter A, B, C, F. The nurse should provide information about foods and measures that will prevent odor from a colostomy. Parsley, yogurt, buttermilk, and cranberry juice will prevent odor. Charcoal filters, pouch deodorizers, or placement of a breath mint in the pouch will also eliminate odors. Foods that cause flatus and thus odor, including broccoli, Brussels sprouts, cabbage, cauliflower, cucumbers, mushrooms, and peas, should be avoided. Priority nursing tip: body image is a concern for a client with a colostomy, and the nurse needs to be sensitive to the client when discussing this concern with the client. Question number 24.
When a client experiences frequent runs of ventricular tachycardia, the primary healthcare provider prescribes flecainide. Because of the effects of the medication, which nursing intervention is specific to this client's safety? A.
Monitor the client's urinary output. B. Assess the client for neurological problems. C. Ensure that the bed rails remain in the up position. D. Monitor the client's vital signs and electrocardiogram (ECG) frequently. Letter D. Monitor the client's vital signs and electrocardiogram (ECG) frequently. Flecainide is an antidysrhythmic medication that slows conduction and decreases excitability, conduction velocity, and automaticity. However, the nurse must monitor for the development of a new or worsening dysrhythmia. Options A, B, and C are components of standard care but are not specific to this medication. Priority nursing tip: monitor the client receiving flecainide for an increase and severity of dysrhythmias. This adverse effect may warrant a decrease in dosage or discontinuation of the medication. Question number 25. The nurse provides information to a client diagnosed with gastroesophageal reflux disease, GERD. What information should the nurse include when discussing foods that contribute to decreased lower esophageal sphincter, ileus, pressure and thus worsen the condition? Select all that apply. A. Alcohol, B. Fatty foods, C. Citrus fruits, D. Baked potatoes, E. Caffeinated beverages, F. Tomatoes and tomato products. Answer, letter A, B, C, E, F. GERD, gastroesophageal reflux disease, occurs as a result of the backward flow, reflux, of gastrointestinal contents into the esophagus. The most common cause of GERD is inappropriate relaxation of the LES, which allows the reflux of gastric contents into the esophagus and exposes the esophageal mucosa to gastric contents. Factors that influence the tone and contractility of the LES, lower esophageal sphincter, and lower LES pressure include alcohol, fatty foods, citrus fruits, caffeinated beverages such as coffee, tea, and cola, tomatoes and tomato products, chocolate, nicotine and cigarette smoke, calcium channel blockers, nitrates, anticholinergics, high levels of estrogen and progesterone, peppermint and spearmint, and nasogastric tube placement. Baked potatoes would not contribute to worsening the problem. Priority nursing tip: teach the client with gastroesophageal reflux disease, GERD, to avoid lying down with a full stomach and avoid eating within 2 to 3 hours of bedtime, to avoid wearing tight-fitting clothing, particularly around the waist, and to sleep with the head of the bed raised at least 6 to 8 inches. Question number 26. The nurse is developing an educational session on client advocacy for the nursing staff. The nurse should include which interventions as examples of the nurse acting as a client advocate? Select all that apply. A. Obtaining an informed consent for a surgical procedure. B. Providing information necessary for a client to make informed decisions. C. Providing assistance in asserting the client's human and legal rights if the need arises. D. Including the client's religious or cultural beliefs when assisting the client in making an informed decision. E. Defending the client's rights by speaking out against policies or actions that might endanger the client's well-being. Answer, letter B, C, D, E. In the role of client advocate, the nurse protects the client's human and legal rights and provides assistance in asserting those rights if the need arises. The nurse advocates for the client by providing information needed so that the client can make an informed decision. The nurse needs to consider the client's religion and culture when functioning as an advocate and when providing care. The nurse would include the client's religious or cultural beliefs in discussions about treatment plans so that an informed decision can be made. The nurse also defends clients' rights in a general way by speaking out against policies or actions that might endanger the client's well-being or conflict with his or her rights. Informed consent is part of the primary healthcare provider-client relationship. In most situations, obtaining the client's informed consent does not fall within the nursing duty. Even though the nurse assumes the responsibility for witnessing the client's signature on the consent form, the nurse does not legally assume the duty of obtaining informed consent. Priority nursing tip: the nurse is a care provider who spends a significant amount of time with the client, and therefore is in a critical position to act as a client advocate. Question number 27. The registered nurse, RN, planning the assignments for the day is leading a team composed of a licensed practical nurse, LPN, and an unlicensed assistive personnel, UAP. Based on licensure, which client is most appropriate to assign to the LPN? A. A client diagnosed with dementia. B. A one-day postoperative mastectomy client. C. A client who requires some assistance with bathing. D. A client who requires some assistance with ambulation. Answer, B letter, A one-day postoperative mastectomy client. Assignment of tasks must be implemented based on the job description of the LPN and UAP, the level of education and clinical competence, and state law. The one-day postoperative mastectomy client will need care that requires the skill of a licensed nurse. The UAP has the skills to care for a client requiring non-invasive care such as a client with dementia, a client who requires some assistance with bathing, and a client who requires some assistance with ambulation. Priority nursing tip: do not delegate an activity to anyone who has never performed the task.
Perform the activity with the individual and teach her or him about the procedure for performing it. This ensures client safety. Clients who are potentially unstable or complicated need to be assigned to licensed staff. Here are the scope of practice. For RN or registered nurse, they should do the following: clinical assessment, initial client education, discharge education, clinical judgment, initiating blood transfusion. For the LPN or licensed practical nurse and LVN or licensed vocational nurse, they should do the following: monitor RN findings, reinforcing education, routine procedures, excatheterization, most medication administrations, ostomy care, tube patency, enteral feeding, specific assessments. And for the UAP or unlicensed assistive personnel, they should do the following: activities of daily living, hygiene, linen change, routine, stable vital signs, documenting input-output, positioning.
Question number 28.
The nurse is delegating unit nursing tasks for the day. Which tasks should the nurse delegate to the unlicensed assistive personnel, UAP? Select all that, apply. A. Deliver fresh water to clients. B.
Empty urine out of Foley bags. C.
Take temperatures, pulses, respirations, and blood pressures. D.
Count the substance control medications in the opioid medication supply. E. Check the crash cart, cardiopulmonary resuscitation cart, for necessary supplies using a checklist. F. Check all intravenous, solution bags on clients receiving IV therapy, for the remaining amounts of solution in the bags. Answer: letter A, B, C.
Delegation is the transfer of responsibility for the performance of an activity or task while retaining accountability for the outcome.
When delegating an activity, the nurse must consider the educational preparation and experience of the individual.
The UAP is trained to perform non-invasive tasks and those that meet basic client needs. The UAP is also trained to take vital signs. Therefore, the appropriate activities to assign to the UAP would be to deliver fresh water to clients, empty urine out of Foley bags, and take temperatures, pulses, respirations, and blood pressures. Although the UAP is trained in performing cardiopulmonary resuscitation, the UAP is not trained to check a crash cart, and this activity must be assigned to a licensed nurse. Any activities related to medications and IV therapy must be delegated to a licensed nurse. Priority nursing tip: to ensure client safety, it is very important for the nurse to delegate appropriately to the UAP. Most tasks that are non-invasive can be assigned to the UAP. Here are the scope of practice. For RN or registered nurse, they should do the following: clinical assessment, initial client education, discharge education, clinical judgment, initiating blood transfusion. For the LPN or licensed practical nurse and LVN or licensed vocational nurse, they should do the following: monitor RN findings, reinforcing education, routine procedures, excatheterization, most medication administrations, ostomy care, tube patency, enteral feeding, specific assessments. And for the UAP or unlicensed assistive personnel, they should do the following: activities of daily living, hygiene, linen change, routine, stable vital signs, documenting input-output, positioning.
Question number 29.
In the middle of bathing a client, the unit secretary notifies the nurse that there is an emergency telephone call. Which action should the nurse implement to best assure client safety? A. Quickly finish the bath before answering the call. B. Immediately leave the client's room and answer the call. C. Cover the client, place the call light within reach, and then leave to answer the call. D. Leave the door open and ask staff to monitor the client, and then leave to answer the call. Answer: letter C. Cover the client, place the call light within reach, and then leave to answer the call. Because the telephone call is an emergency, the nurse may need to answer it. To maintain privacy and safety, the nurse covers the client and places the call light within the client's reach. Additionally, the client's door should be closed or the room curtains pulled around the bathing area.
The other appropriate action is to ask another nurse to accept the call.
This, however, is not one of the options. None of the other options effectively meet the client's safety needs. Priority nursing tip: if it is necessary to leave the client's bedside, return the bed to low position, elevate side rails as appropriate per state and agency policies, place the call light in the client's reach, and ensure that the client knows how to use it.
Question number 30.
The nurse manager reviewing the purposes for applying restraints to a client determines that further education is necessary when a nursing staff member makes which statement supporting the use of a restraint. A.
It limits movement of a limb during a painful procedure. B. It prevents the violent client from injuring self and others. C.
At night it keeps the client in bed instead of wandering about. D.
It is useful in preventing the client from pulling out intravenous lines.
Answer: letter C. At night it keeps the client in bed instead of wandering about. Wrist and ankle restraints are devices used to limit the client's movement in situations when it is necessary to immobilize a limb. Restraints are not applied to keep a client in bed at night and should never be used as a form of punishment. Restraints are applied to prevent the client from injuring self or others, pulling out intravenous lines, catheters, or tubes, or removing dressings.
Restraints also may be used to keep children still and from injuring themselves during treatments and diagnostic procedures. A primary healthcare provider's prescription is required for the use of restraints, and state and agency procedures are always followed when restraints are used. Priority nursing tip: assess the client with restraints applied continuously to determine if the restraints remain necessary. Thank you for watching and listening. Please subscribe and click the notification bell to be updated for more videos.